In this video, I'm going to cover everything you need to know about animation deformity after breast reconstruction. What is it, what it feels like, what it looks like, and how it impacts your movement. Hi, I'm Erica. I'm a breast cancer thriver and a chiropractor. I've actually been putting off making this video for a while now. Being so active, animation deformity does bother me, but I've hesitated to make a video about it because it sounds like I'm just complaining by talking about it. Usually when I make a video about some of the side effects post-cancer, I'm sharing ways that you can actively manage or improve them. But this isn't one of those cases, and I find this frustrating, but I think there's still value in sharing this. Let's start by talking about what animation deformity is. I'll sometimes call it animation for short. With breast reconstruction, tissue expanders and implants can either be placed over the chest muscle, called pre-pectoral, or under the muscle, called subpectoral. I might also use the terms pec and chest interchangeably, since your pectoralis muscle is your chest muscle. Now, animation deformity only happens when implants are placed under the muscle. If your implants are over the muscle, there'll be no animation at all. Normally, your chest muscle sits flat against your rib cage. But when implants are placed under that muscle, anytime your pec contracts, like when you reach, push, or lift, it compresses the implant. And that causes it to move, usually up and out to the side towards the armpit area. This movement is normal and expected. It happens to everyone with subpectoral implants, but the experience can really vary person to person. Some people barely notice it, while for others, like me, it's really noticeable. Animation isn't just about how things look and feel, it can also affect your function. Personally, I don't love the look or how it feels, but it's really the functional changes that bother me the most. Before my double mastectomy, I did a lot of research on implant placement because I'm so active. And there were two things that I came across online that really stuck with me and made me a bit hesitant to go under the muscle. The first was a blog post by an active woman who was describing her animation after breast reconstruction. She was on a canoe trip wearing a bikini, and she wrote about how every time she paddled, the inner part of her breast visibly contracted. And I know exactly what she's talking about because I notice the same thing when I do stand-up paddleboarding and many other activities, which I'll talk about coming up. The second was a YouTube video from a CrossFitter who'd had breast augmentation, so not reconstruction, but still with implants placed under the muscle. She was showing what her implants look like doing something called a muscle up on the rings, which requires a lot of pec activation. This was a movement that I used to do before my surgery. But once you get up on the rings, you're actually straightening your arms out to do a dip. She paused the video mid-movement. You could see the implant shift out towards the side of her chest. Not all the way in her armpits, but definitely far off from where they started. Let's talk more about the functional changes that happen. With under the muscle reconstruction, your chest muscle is permanently in a stretched position because the implant or tissue expander always sits underneath it. When muscles are overstretched, they don't activate as effectively, and this can lead to weakness in your chest when you're using those muscles. I knew pretty quickly after surgery that my strength was different. Even though I wasn't doing chest exercises at that point, I started to notice the weakness with everyday movements, and even more once I added exercises back in. To test this, I'd place my hands together in front of me and push them together. It felt like I had zero strength compared to before surgery. It wasn't actually zero, but it was a significant difference compared to before. Now, fast forward to a few years post-surgery, I'm still really weak when I do that test and pretty much anything that requires chest activation. I've done far fewer chest exercises since surgery compared to what I was doing before, so I'm naturally going to be weaker overall. But remember, the function is really tied to that pec muscle being in an overstretched position, and that's not changing. So I can just tell my pecs don't activate like they used to. What does animation deformity look like? You can try testing this yourself by placing your hands on your waist and then squeezing inward. This activates your pecs and you'll see the changes as the implants move. The skin on the top of the breast can get distorted, kind of like it scrunches or puckers. Under clothing, you can't really see the skin changes, but you can see the breast itself shift when you use your chest muscles. Sometimes there's a noticeable difference from one side to the other. For me, I noticed more of that scrunching on the side that had cancer. During the mastectomy, there was much more tissue removed on this side, so the skin in front is just a little bit thinner and it makes the distortion more obvious. Interestingly, there's actually less movement on this side though, because this is a side that I had radiation. And radiation causes a shrink wrap effect, so everything tightens up due to radiation fibrosis, and then the capsule that surrounds the implant can get a bit tighter. Here's my radiated side, so you'll see some movement, but it's more limited because of the tightness from radiation. And here's my non-radiated side. You can see there's a lot more motion here. But even though there's more movement, the scrunching is actually less visible on this side because there was more soft tissue left over in front of the implant. What does animation deformity feel like? For me, it feels like a twitch sensation every time I activate my pec. The first time I noticed this was right after surgery. I think it was the day of or the day after. I was lying on my back in bed, sat up, and then I put my arm slightly behind me to scoot forward, which activates your pec. I instantly felt that weird twitching sensation. I knew movement of the implants was a side effect of going under the muscle, but I'd never heard anyone talk about that twitch feeling, and so it really caught me off guard. I'm not sure if everyone experiences this to the same extent, but my pecs were pretty strong going into surgery, so there would be more muscle activation when those muscles are used, even for everyday movements, and potentially more of a twitch sensation. The twitch sensation has reduced over time. When I had tissue expanders, it started to fade about a few months after surgery. And then when I had my exchange surgery, that twitch sensation came right back, but again faded over time. Now, being over 3 years out for my exchange surgery, I still feel that twitch sometimes, but it's less intense, which I'm thankful for. Having said that, the amount of animation or the amount the implant moves when my pec contracts hasn't really changed. I would even say that it's increased a bit over time as the pocket size or where the implant sits has gotten a bit bigger. I don't think this happens to everyone, but it's likely related to how active my job is as a chiropractor and then the repeated pec contractions required. More on that coming up. When I try to explain this to someone who doesn't have implants, I say imagine putting an implant under your calf muscle and then trying to skip, or under your quad or thigh muscle and doing squats. It would just feel weird, off. Not painful, but not natural either. Well, that's what it feels like to have an implant under your chest muscle. Will it always feel weird? I have no idea, but if you stuck an implant under my calf muscle and then fast forward 5 or 10 years, I'm guessing it would still feel weird, just maybe not as noticeable. Now let's talk about examples of when I notice animation in everyday life, during workouts, and even at work. For me, it's not just about the implant moving and what that looks like, it's about how it feels and the loss of strength in my chest. Everyday movements were the first times that I noticed something just felt off. Things like opening my tamoxifen pill bottle. It sounds simple, but the motion of squeezing and then twisting requires more chest activation than you think. I got my husband to open the bottle for me for many weeks, if not months, after surgery. This was such a disconnect as I was starting to lift heavier weights at the gym, the ones that didn't activate my pecs, but I still had trouble opening the tamoxifen bottle. So the weakness is just so specific to that muscle. Household tasks like wiping counters, vacuuming, and sweeping. I wasn't doing those chores right away, but once I tried, I could feel how different my body moved. Especially with vacuuming, I still actually feel the twitching sensation as I push and pull if I'm vacuuming a carpet. If I were scrubbing the surface of our glass stovetop, if something's really stuck, what would take my husband 5 minutes would probably take me 20 minutes to get off. Closing snap lid Tupperware. This is still a challenge and it continues to surprise me with how difficult it feels. It's such a specific chest movement, kind of like doing chest flies at the gym. Being a few years out from my surgery, my weights are even heavier now, but I still ask my husband to close the really tough lids. Sometimes I'm able to modify the movement where I lean over and put my body weight into the movement as I'm pressing the lid edges down. Sometimes it works, sometimes it doesn't. Closing our heavy screen door. That motion of reaching across the body mimics the chest exercise like the last example. I still don't close the screen door like I used to. I shift my stance over to one side and then I use my body weight rather than relying solely on my chest. With sports, some activities that I enjoy feel different now. I talked about stand-up paddleboarding earlier. I don't just see the animation when I paddle, I feel it. At a friend's cottage, we used to paddle around the island, maybe an hour and a half. And now I just paddle sort of in their little bay area just because it feels so different in my chest area when I'm paddling, and it's just much weaker. As expected, animation is most noticeable when I'm wearing a bikini. There's just less coverage, so any movement of the implant is just easier to see. One of the clearest examples for me is when I'm at the beach with my son making sandcastles. That forward pulling in motion, scooping up the sand really activates my chest muscles. It's such a reminder every time I do it, and it's just sort of sitting there in the background even when I'm doing super fun things. If I'm getting out of the pool, it's quite noticeable. It also just feels uncomfortable, so I tend to use the stairs or a ladder to get out of the pool now. It even happens when I'm lounging on the beach chairs propped up on my elbows. It's not that I'm bothered because other people can see the animation, it's that I can see it and feel it. So while it is frustrating, it's not enough to change what I'm wearing at the beach. I'm still wearing a bikini. I like to go rucking or walking with a weighted backpack a few times a week. And while the walk itself is fine, doing up the waist strap on the bag is a challenge because of the chest activation required. Again, it's similar to that motion of doing chest fly exercises. At the gym, even though I've been training consistently since surgery, I still modify a lot of exercises. And staying active has always been such a huge part of my life, so adjusting to what my body can and can't do has not been easy, and there's definitely been some tears along the way. These are some of the movements where I notice animation the most. Changing barbell plates is more on the side that holds the bar rather than the one putting on the plates. Lifting plates from a weight stack. I'm totally fine lifting the smaller weights, but I often ask for help with the heavier ones. Picking a heavy dumbbell off the floor to start the first rep of an exercise. I'm fine once I get going, but the twitch sensation is much more intense just with that first rep picking it off the ground. When I added back in pull-ups after my surgeries, I tried doing an eccentric variation because I found regular pull-ups were just too difficult to do. For this variation, you basically jump up with your chin above the bar and then try to slowly lower down. Who knew, but there's a ton of pec activation at the top of that movement, and it just felt so weird, so I stopped doing those. I typically do assisted pull-ups instead, using my feet on the ground to help. With the ski erg machine, I notice the animation only when I'm pulling right at the top of the movement. Once I'm through that upper range, it feels just like it used to for the rest of the movement. I notice it with plank variations where you're essentially using one arm at a time. I don't do these anymore and tend to do these kneeling rather than on my feet to reduce the amount of pec activation, or I just substitute the exercise. There are a few movements that I still avoid completely, things like push-ups and burpees. Also movements on the rings like dips and muscle-ups. These all involve a lot of isolated chest activation, and I'm just not comfortable doing them. I substitute these movements when they come up in workouts. I mostly avoid flat bench press, or I'll do this with very light weights. Sometimes I do this only on my radiated side with a heavier weight. This side is quite a bit weaker post-radiation, but also has less movement of my implant, so I'm not as concerned about the animation on this side. Sometimes I'll do an incline chest press rather than doing it flat on my back. There's more activation of the upper pec fibers, and so I find there's a little less animation when I do it at that angle. As a chiropractor, I always knew my job was really physical, but I didn't realize just how much I used my pecs until after surgery. I feel it most when I'm doing hands-on treatment, not just when I'm moving my arms, which activates my chest. I actually feel it more when I'm pressing into tissues using a sustained force. Neck adjustments are doable, but come with a lot of animation and definitely more effort compared to before because of the weakness of my chest muscles. My non-radiated side implant moves much more than my radiated side, again because it doesn't have that contracture from radiation. These movements are very pec dominant, and I haven't got completely used to this because it feels like such a quick, forceful movement of the implants every time I do it. I haven't gone back to doing pelvis and low back adjustments. There's just too much chest activation, and I don't have it, still being a few years out from surgery. If this video has been helpful to you so far, hit that like button below, and if you're new here, consider subscribing. With animation, the movement of the implant is temporary. Once the muscle relaxes, the implant returns to its usual position. But does it stay in that position long term? This is the concern that I raise with my plastic surgeon, especially because I have such an active job that I use my pec muscles all day. I was cautioned that doing chest exercises could over time cause lateral displacement, where the implant gradually shifts outward and stays there. Because of my work, this really concerned me, and I think I asked questions related to animation at every single appointment that I had with my plastic surgeon, and I had a lot of appointments. I even booked a consultation with another plastic surgeon who does both reconstruction and augmentation just to get more information. I asked him, can chest exercises increase the pocket size where the implant sits? He said yes, repetitive use can stretch that space, and then a larger pocket means the implant has more room to move, especially to the side. I also asked, do you see outward or lateral displacement of the implants? Again, yes was his answer. He says he does revision surgeries for these. It's usually something that happens over time, not from a single movement, but from repeated pec contractions over the years. In terms of exercises, how do I decide which movements to continue and then which to omit? As a general rule, I've chosen to limit chest-specific training, but this doesn't necessarily mean that you need to as well. Given how much chest activation there is with my work, basically doing chest exercises all day when I'm treating patients, I didn't want to add to this by also training my chest muscles at the gym. My perspective is that if I did want to go all in with chest exercises, I would also need to be okay with possibly needing revision surgery. And right now, I'm definitely not okay with this, so I'm being cautious. Does everyone experience animation? Yes, but not everyone notices it the same way. Some women aren't as aware of the movement, which honestly sounds pretty amazing, and others, like myself, really notice the difference. I'm not sure if this is related to an increased body awareness, so you're going to notice that animation more, or if it's more related to increased strength of the chest muscles, and then you'll get more animation as a result. So why would someone choose to go under the muscle when there's so many downsides? Sometimes it's not actually a choice. You may not be a candidate to go over the muscle, and that was the case for me. To go over the muscle, you need to have enough healthy tissue left after the mastectomy. In my case, the flap that was left was too thin, which meant reduced blood flow and then a higher risk of tissue necrosis. So going under the muscle was the better option for me. There is a shift where there are more surgeons offering over the muscle as compared to in the past, but some may prefer to still do under the muscle if that's what they've always done. Have I made peace with this side effect? Not quite. This is still a work in progress for me. So much of this journey has been about adjusting to that new normal that everyone talks about. And animation shows up in so many different parts of my life that it's a constant reminder that my body is different than it was before cancer. Is the animation so annoying that I'd explant my implants? You might be surprised to hear, but that's never actually been a consideration for me. While I am frustrated with the animation, I'm also deeply grateful to have these reconstructed breasts, and they have helped immensely with my recovery. I always knew right from the first time I decided to have a double mastectomy that I was also going to have reconstruction. And so I see the animation as a trade-off of what comes along with having implants under the muscle. I'd really love to hear your experiences, so drop them in the comments. This not only helps me, but others who are reading the comments looking for support, reassurance, and maybe a different perspective. What advice did your surgeon give you about chest exercises? Do you notice animation as much as I do, and does it bother you? If you're active, do you modify or avoid certain movements, short-term or long-term, because of it? Let's keep the conversation going in the comments. Your story might be exactly what someone else needs to hear today. See you next time.